My name is Dr. Jennifer Christie. I'm an associate professor of medicine at the Emory School of Medicine in Atlanta, Georgia, and I'm director of gastrointestinal motility.
All right. And what should people expect getting the colonoscopy for the first time?
The first time you get your colonoscopy, once you arrive to the facility, usually we ask patients to arrive about an hour early um, because that gives us time for you to fill out all the necessary paperwork. And once you are given that paperwork and it's completed, and you sign all the necessary forms, you're brought back to our endoscopy area. And usually you're prepped in a separate area where the nurses will ask you your medical history and about what medications you take, and if you've had any surgeries or have any allergies, and if you've ever had a colonoscopy before, of course. And then also they'll ask you about your prep, if you took it all and if things are running pretty clear. And then they will ask you to undress, and they'll give you a gown to put on, and you will be given a stretcher where you can lie on comfortably. The nurses will then put a IV or intravenous into one of the veins so that we can give you the sedating medication as well as some fluids, because you can expect to be kind of dehydrated when you come in for your procedure. And then depending on the type of sedation that you're going to receive, sometimes the anesthesiologist will actually come over and talk to you, because oftentimes now we're using propofol for sedation. It's used very safely. But other times we use other sedating medications that also work very well. And then after you have your IV and the anesthetist talk to you, you're rolled back into the procedure room where your doctor will be waiting for you. Again, we'll explain the procedure, explain any potential complications of the procedure. And the three most important complications of colonoscopy are bleeding, infection, or perforation of the colon with our scope or a piece of the equipment that we use. And these complications are rare, and they're usually associated with having to take out a polyp. But again, these are rare complications. And then after you understand the complications, you sign our consent form. We then do a call to order, which is to make sure it's the right patient, right procedure. Um, and then we give you the sedation. Once you're nice and comfortable, oftentimes you're totally asleep, then we insert our colonoscope, which is the equipment that we use to do the procedure, into the rectum. Well, there are a lot of myths that people have out there, and I think that's why it's important to really understand the truth and to get as much information by reliable people like your doctors as you possibly can, and nurses and other medical professionals. But common myths are that it's really painful. It's rare that it's really painful. Most of the time, people don't remember the procedure, but sometimes it can be just a little bit complicated. But most of the time, people are pretty comfortable. Other myths about the procedure are that the prep is always horrible and terrible to take, but not all people feel that way. Some people say it's not so bad, and they actually enjoy being cleaned out for that day or two as they're preparing for their colonoscopy. Um, the other myths that people have is, are that, you know, that bad things happen from colonoscopy all the time or very often, and that's just not the case. But you make sure you do your homework, do your research, and get a referral to someone who has a good reputation that you can trust.